Boxer Chris Eubank says he's devastated himself. He died yesterday morning in Dubai. We're up to 10 minutes past 9. Now, perhaps you want to get out this weekend. Perhaps you're thinking, what's it going to be like later in the week? Because it's Louise Lear is the woman who's going to bring all the answers.
Be prepared for a little bit of everything over the...
Got a COVID panel, of course. We're going to catch up. You were saying just earlier, there's been so much news this week in terms of changes, of course, and looking at the NHS COVID app, whether we're wearing masks, travel restrictions and, you know, double vaccinations, how important that is if you're interested in travelling out of the UK. So we need some answers.
We do, and we know where to get them as well. Let's join our regular Saturday morning breakfast COVID panel. Virologist Dr. Chris Smith, morning to you, and Professor of Public Health, Linda Ball. Morning to you. Hi, Linda.
Morning.
It really does feel like it's been a packed week.
The mistake of taking 5 days off, so I was trying to keep up this. It's really so fast moving, both in terms of the new data that's released, the studies, etc. But what we can see around the UK this week is I suppose, good news and bad news. The good news is that we're still seeing more and more evidence of the fact that the vaccines are effective, particularly after both doses, and the number of people in hospital is nowhere near what it was, for example, near the beginning of 2021. In fact, we know that the proportion of people who test positive with this virus, with the disease COVID-19, it was around 13 to 15% of them who might have ended up in a hospital at the beginning of the year. We're now down to between 1% and 3% as a proportion. So that's good news. But if you look at the ONS infection survey released on a Friday, we've had some quite scary numbers for Scotland. It's retrospective up to the 3rd of July, but we've got as many as 1 in 100 people here during that period who had the virus. And those infections are largely in younger people. In fact, some of our hospitals here in Scotland are already really overstretched. So it's a fragile situation while we look ahead to more opening up, with different parts of the UK going at a different pace. And
some 1.2 million people in the UK work for the NHS, many of them frontline staff directly involved in caring for patients. And if they get pinged and they're told to stay at home or advised to stay at home, it can very quickly compromise the ability of hospitals and other ancillary NHS services to provide the care that we all need. And also remember, it's not just dealing with COVID patients. In fact, COVID is accounting for a very small amount of the workload in the NHS at the moment. We think about 2,000 or 3,000 people are in hospital at the moment, which is somewhere in the order of a couple of % of all the beds that the NHS has. We're actually in catch-up mode. We're desperately trying to dig a big hole in the enormous mountain of backlog we've got from, I think a very high fraction. There's only a very small minority of people who haven't been vaccinated in the NHS. It's maybe out of 1.2 million people, perhaps 100,000, 200,000 people who haven't been double vaccinated. They're saying because of the high likelihood of people receiving a ping from the app, maybe what we should do is to consider the possibility of, if we've got a double jabbed person who we judge to be at very low risk of coronavirus infection, let's face it, if they get a ping, maybe we should say we could substitute regular testing for those people instead. This is something being considered, that you could swap staying at home and isolating for just regular daily testing.
Some freedoms back, that so-called Freedom Day. Living with the virus, she's asking, what does that mean? We have to start living with the virus. What advice can you give, Linda, to ensure that we stay safe and healthy?
Ask at the moment, and thanks to Jacqueline for raising it. There's a difference, John, isn't there, between what government, what laws are in place, what regulations are there, and what we're required to do by law, and also what people are able to do to protect themselves and others. So even if the government at UK level says that face coverings, for example, are not mandatory everywhere in public places indoors, it doesn't mean that people shouldn't choose to continue to use them. And in fact, when you look at some of the surveys that have been done, the majority of people say they will continue to wear a face covering after the 19th of July. Now, I know it's not something that we all want to do. The first one is try and understand what the risks of any particular situation are for yourself. Have you had both doses of the vaccine? Are you 14 days after, etc.? Is it a crowded, busy indoor place? Should I go there or can I go somewhere else? So understand the risks and make your own decisions. The second thing is think about what you can do to protect yourself and others. And the key point about a face covering, which we perhaps haven't seen as much discussion of recently, is to protect other people. That's the primary aim. So even if you're young and healthy, you might have had both doses of the vaccine, there's still people who are extremely clinically vulnerable. And then the third thing is obviously just be aware that taking up both doses of the vaccine, maybe a booster in the autumn, is important, and regular testing. So those are the communities to local leaders and to national leaders that we need to continue to invest in, not just the NHS, but test and trace and the other things that are really important to us. I think we all have a role to play. You know, we've seen, haven't you, I think you've been covering in the programme, John, the letters from the Academy of Medical Sciences, from the Royal Colleges. Many of my colleagues, while I was away, were writing this week about the fact that infection's still high. We do have to live with this virus. It will become endemic. But I think as we move through this period, it's just important that while businesses need to be open and we need to focus on things like travel and the economy, the risk has not gone away, and therefore we need to be proportionate. I think as a simple behavioural thing, we can do that. And the final point I make on face coverings is if people want good advice, do go on to NHS pages, etc. Make sure you've got a well-fitting one. And for people who are vulnerable, even think about what we call double masking, which is to wear your cloth face covering and underneath a surgical mask. That gives a bit more protection.
Face coverings at work at the moment anyway. So really, in that sort of respect, I won't expect to see any major and dramatic changes.
I'm talking about your everyday life outside the office.
Well,
obviously.
I'm not using public transport to get to work. So I'm not experiencing it in that respect. My daughter is, so I suspect that probably get some pushback on that. But I'm not using public transport, so I'm in my own car getting to work. And I live not near many other people, so I don't actually find myself in places, apart from the odd visit to a shop, where I have to do this. But I appreciate that there are some people for whom this is a bit of a daily grind. But hopefully we will, as we get out of this thing, we'll find that it relies on close, extended, prolonged contact between individuals to spread. So wherever you have a situation where there are lots of people getting together, we will see as a direct consequence of that inevitably transmissions. So there will be cases caused by people either travelling to, being at or going home from these sorts of mass gatherings. So we have to expect that that's going to happen and anticipate it. But we can be somewhat reassured by the fact that if you look at the data, the people who are catching the infection are tending to have a mild infection if they've been vaccinated. Thirds of the cases that might otherwise happen, but that still leaves a very significant number potentially of cases. So people need to remember that this hasn't gone away. We have got, that we know of, at least 30,000 cases of the infection in the country each day at the moment.
And they were people outside in the open air, and we always talk about ventilation.
What do you think about people who would race a tractor?
No. Do you think, is there somebody...
Slightly strange things during lockdown. I reconnected with a hobby that I used to have some 20 years ago, which is doing mechanical engineering. I used to do lots of mechanics. I used to do lots of cars, motorbikes, go-karts, that kind of thing. And I kind of got sidetracked into other things. But lockdown refocused me on what I used to do and what I used to very much enjoy. And I thought, I fancy a new challenge. What haven't I done before? I haven't done a farm tractor. So I went onto a well-known online auction site and I managed to buy a vintage 1961 Fordson Supermajor built at Dagenham, almost shares my birthday in terms of birth month. And over lockdown, turned this thing from something that didn't run very well, didn't look very good, didn't sound terribly good, into something that's now extremely nice to look at. Still makes quite a lot of smoke and noise, but it runs pretty well. And we have arranged to have a big vintage tractor run this weekend. So we think we're going to get 100+ machines of similar sort of vintage. Combined age 7,000 years, and that's just the people driving them. Charitable trust, which has obviously helped all of us to stay well during the pandemic. So if people would like to come and support, we're urging people to coalesce at the beautiful village of Barrington in Kidden 20 of these very, very impressive machines charting the history of farming and farm tractors for the last 80 years.
Well, enjoy it. Linda, I was away last week. Is the clock new? Is the Scotland clock new?
Yes. So what we were just, and can I just say, Chris, I didn't get an invitation to the tractor.
Oh.
So I'll be...
You're most welcome,
happy.
Linda. We do actually have a party trailer taking part. So if you'd like to come and join in, we've got a trailer, which some of the kids are going in. You'd be welcome to join the kids in the trailer. And you can be towed all through Cambridgeshire.
If only I was closer. But anyway, The clock we discussed last week, Naga, Chris is moving house in the future, and I bought it for him as a gift because I know he needs a memory of Scotland. So he's not moved yet, but once he does, it'll be back in his box. It'll be going down to Cambridgeshire, even if I'm not tomorrow, I emphasise. And for him.
I can't believe, like, on TV, Professor Linda Bolt has simply turned Chris down flat to sit in his kiddie trailer
She's
in his
aired
tractor.
him. She's aired him.
Gosh, that's harsh. That's brutal. Anyway, look, hopefully you can resume, make this better by next week when we have the COVID panel back, eh?
Any comparable
I'll have to
hobbies,
make her a better
Linda?
offer.
We can't. We've got.
No, I'm struggling to think of any. I'm not allowed to go near any machinery, John. It's kind of a...
Especially if it's in Cambridgeshire, right?
Professor Linda Bold, virologist Chris Smith. It's always a joy having you on the programme. Look, take care of
Pleasure.
yourselves and good luck tomorrow, Chris.
Take care. Bye-bye.
Bye.